everyone, how are you today? I am Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, I make videos about health and healthcare topics, and today we are going to talk about Irritable Bowel Syndrome, IBS. This topic has been requested many times and it has been confused with IBD, Irritable Bowel Syndrome with Inflammatory Bowel Disease. These are two different diseases. Even I get confused many times. Mostly the symptoms are same, even the treatment sometimes are similar, but the reason is different. There are some things which are different in these two diseases. In inflammatory bowel disease, you have inflammation, you have redness and swelling of the abdomen, of the intestines, right? And in irritable bowel syndrome, you don't have inflammation, you don't have these kind of signs, right? There's this redness and swelling in the intestine, you don't have that. So what is this? What is irritable bowel syndrome? Why is this caused? What is the reason behind it? How to diagnose it? How to treat it? This is one of the most common reason why patients come to a gastroenterologist. Yes, this irritable bowel syndrome. So let's dig into this and let's find out more about this condition.
The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
Irritable bowel syndrome is a disorder. Obviously, this will also lead to abdominal pain and bowel changes. You might have loose motions and then constipation, loose motion, constipation. So there has to be a reason, right? Although there is no one single reason, but the reason is nerve stimulation, right? The nerve impulses which actually control your bowel movements are coming directly from the brain. So this nerves hyper stimulation happens because of hypersensitivity of your intestines to nerve stimulation. This hypersensitivity can occur because of a trigger. Mostly this trigger can be something which you eat, this can be stress, and this even can be after some bacterial or parasitic infection. In this case it is called post-infectious IBS. So this becomes the trigger. Now the brain controls your intestines through hormones and nerve signals, and these signals, these basically control your peristaltic movements, and when the signals are hyperactive, your intestines are very active, and therefore you have loose motions. And then sometimes the signals are very slow and your intestines are very slow and you have constipation. So that's how things work in irritable bowel syndrome. So it's a very mild form of disease. I mean, it is not as dangerous as inflammatory bowel disease. You're getting my point? Crohn's disease, ulcerative colitis are more dangerous. They can have bleeding in the stool, they can have ulcers in the intestine. This ulcers, bleeding will not happen in irritable bowel syndrome. Alright, so why is this caused? Nobody knows, but there is hypersensitivity of the nerve supply to your intestines and there are triggers. Sometimes it is post-infectious, sometimes it is without any infection, just because of stress also, right? In stress, your intestine stimulation becomes hyperactive and then you have to run to the motion, run to the washroom, right? So this can occur at any age, but it usually becomes in the teen age group or early childhood. It is twice as more common in women and as men, and is less likely to begin in old people above 50 years of age, right? So the symptoms in IBS vary from person to person. It can range from very mild disease to a very severe disease. Most people have very mild symptoms. You are said to have IBS when symptoms are present for at least 3 days a month for a period of 3 months or more. Only then you are said to have IBS, and the symptoms can include abdominal pain, there can be gas, fullness, bloating, changes in the bowel movements. You can have either diarrhea, which is IBS-D, and constipation, IBS-C. This is how they are called, C and D, diarrhea, constipation, right? So pain and other symptoms will often be reduced or they can go away after a bowel movement, and symptoms can even flare up when there is a change in frequency of bowel movements. So the people who have IBS, they will go back and forth between having constipation and diarrhea, as I've said earlier. And if you have IBS with diarrhea, you will have frequent loose watery stools, and you will have an urgent need to have a bowel movement, which will be very hard to control. And if you have constipation, you will have a hard time passing stool, as well as fewer bowel movements. You may need to strain with the bowel movement and might have cramps as well. And only a very small amount of stool or no stool will pass at all many times. So this is how IBS-C and IBS-D they present, right? So the symptoms of IBS may get worse over a few weeks or even a month, and then get better for the next few months. And some of the symptoms can be present all the time. So this is how IBS presents, and you might even have loss of appetite because of IBS, but you will not have blood in stools or unintentional weight loss because of IBS. That is, these symptoms are more common because of inflammatory bowel disease, right? So talking about the test examination, how do we diagnose? Unfortunately, there is no confirmatory test for IBS. There is no test for IBS. The healthcare providers actually diagnose it on the basis of your history and presenting symptoms, and you are asked to eat a lactose-free diet for 2 weeks, which actually helps the doctors to identify whether it is lactose deficiency or if it is lactose intolerance or not, right? That has to be excluded. So that is one thing. And blood tests are done to see if you have celiac disease or low blood count, anemia, because anemia, low blood count is not associated with IBS. And stool cultures are also done to see if you have any infection, right? And provided doctor can also recommend a colonoscopy, and colonoscopy is a test in which we insert a small scope, endoscopy, through the anus, and we look into your colon. And this test, obviously, you can actually take a small part, biopsy also, and test it later. But colonoscopy is not done in everybody. It's done if your symptoms begin later in life, over the age of 50. If you have any symptoms such as weight loss or bloody stools, if you have abnormal blood tests such as low blood counts, then we have to check if there is any other reason, like maybe it might be inflammatory bowel disease, it might be other diseases. Now there are other diseases which actually present with very similar symptoms. One is obviously celiac disease, other is inflammatory bowel disease, Crohn's disease, ulcerative colitis, and the third is cancer, colon cancer. Yes, cancer rarely causes these kind of IBS problems, but it can. So cancer is one of the things which will present with all these symptoms as well. So what is the treatment? Treatment for IBS is aimed to relieve your symptoms. In some cases, lifestyle changes will help a lot. For example, regular exercise, improving your sleep habits, and reducing your stress, anxiety helps relieve the bowel movements completely in many people. So you have to try that. And dietary changes will also be helpful. However, there is no specific diet that can be recommended for IBS because the condition differs from person to person, right? So there are some things which is recommended. One, avoiding food and drinks that actually stimulate the intestine, like tea, coffee, and colas. Eating small meals frequently, frequent meal, and increasing fiber in diet, right? Eat a lot of fruits, salad, right? Increasing fiber in diet. This improves constipation or even diarrhea, and can also improve bloating, but you have to increase it slowly or else you'll make your bloating worse, right? So you have to talk to your doctor, your provider, your gastroenterologist for medicines also. Sometimes medicines are used, but no one single medicine will work for everyone. So your doctor can use a lot of medicines. So no single medicine works for everyone in IBS, but your doctor might use some anticholinergic medicines like dicyclomine, belladonna, propanthyline, hyoscinamide, and these are basically taken about half an hour before eating to control the intestinal cramps, spasms, right? Biscodil may be given to treat constipation, loperamide may be given to treat diarrhea, low dose tricyclic antidepressant may be given to help relieve intestinal pains, then lubiprostone may be given for constipation symptoms, and rifaximin is an antibiotic which is also given in many patients, right? So these are the options, and also sometimes psychological therapy or even medicines for anxiety or depression may be given for the problems, right? Depending upon case to case basis, depending upon what the doctor feels is needed, right, to relieve the symptom, because it's related to stress, right? That's why these are given. So IBS is a lifelong condition, right? For some purpose symptoms, for some people symptoms can actually come and go, and they might actually control by these symptoms by lifestyle changes or by traveling and by social activities, and symptoms will definitely get better with treatment. And but you have to remember, IBS will not cause permanent harm to your intestines. Also, it does not lead to serious disease such as cancer. IBS does not lead to cancer, and it is not a dangerous disease. So you have to remember, it's just that your intestines are having hypersensitivity to certain triggers. That's it. Nothing else is wrong with you. Right? So this is all about IBS. IBS is also called as spastic colon, irritable colon, mucus colitis, right? It's also called spastic colitis, right? It might be one of the reasons for abdominal pain. So that's all about IBS which you need to know. So don't hesitate to share this information, and make sure to subscribe and hit the bell icon to get notification about my next video. And obviously I have many videos. I have Crohn's disease videos, I will have ulcerative colitis video. Don't forget to watch them, and don't forget to share my channel to your friends and family. I'm Dr. Paramjeet. Those who don't know me, I'm a consultant physician, cardiologist in YASHODA SUPERSPECIALITY Hospital, Nehru, Nagar, Delhi NCR, and this is my channel. Please stay connected to stay healthy. Thank you.